We're here to talk about how to optimize pediatric billing and reimbursement. So this session today is specifically for those pediatric organizations across the country looking to really bolster their billing compliance and revenue integrity programs. My name's Dana Finnegan. I'm the Director of Market Strategy at MDaudit. I've been here almost 7 years. I'm happy to be with you today. Some of the things that I kind of want to do right before we jump in is let you know you're going to definitely get a copy of this deck that we're going through, this PowerPoint. But more importantly, we're going to also send you the recording of this session. And I promise that we'll send you home with some real eye-opening demonstration of how technology can help your pediatric organization. As far as an agenda, I don't want to go through all of these bullets here, but what we're going to do today is really show you how through benchmarking in the ingestion of your claims and remittance data on a daily basis, how technology can help you take a risk-based approach. So you're really concentrating on where you can reduce risk of overpayments, overcoding, but also grab some revenue from that undercoding that's going on. And we're going to show you that in the platform in a moment. We're also at the end, right before we do Q&A. So if you have Q&A, feel free to ask whatever you want to ask, put it in the chat. We'll definitely address it. But we're going to also explore a couple of case studies. I think one in particular where we've had a really great implementation of MDaudit at a pediatric healthcare organization that has seen a huge return on investment. One of the things that I do want to talk about before we get into the platform is just that this is being sponsored by MDaudit. As you can see up there, MDaudit, we're a best-in-class billing compliance and revenue integrity platform. At the end of the day, we really help you recognize some really significant gains and outcomes for billing, coding, and revenue recognition. We've been in the field working with you folks in the pediatric organizations for over 30 years. And that's just a lot of big numbers there. It just means our footprint is nationwide with billing compliance and revenue integrity departments with pediatric organizations and other organizations as well. But just want you to know that we have a lot of experience with exactly what you're doing. So what I want to do right now is actually jump into the platform. We only have a half an hour today, so we have a lot to go through. Let's talk about what you're looking at right now. So how do we help pediatric organizations take a risk-based approach? We're doing that through claims data, and we're also doing that through remittance denial data. Right now, we're going to look at one of the claims data pieces of the platform. So right here, what this is representing is this to you. Once we were to ingest your data, we could take all of your pediatricians, your pediatric providers, and strewn them across this continuum. And what we're able to do through analytics and benchmarking, which I'll explain in just a moment, is really take out the middle. We don't want you concentrating on the middle. That's where your pediatric providers are coding appropriately. Where we have the concern is down on the lower left, where we know there's habitual undercoding going on in loss of revenue. And over on the right, the upper right, that's where we're going to be able to identify those that are habitually overcoding and exposing your organization to risk. Again, we know you have limited staff, a ton of things to do. You've got to bake in time for education with your providers and corrective action plans. So let's remove that middle. So again, this is everyone that's billing out E&Ms from your pediatric specialties. Now, you can see here, I can choose any E&M category I want. Today, we're going to stick with established patient. But in just one click, and I'm going to explain this, to the MDaudit pediatric cohort or benchmarking, that would allow you at your pediatric organization to benchmark yourself against all of the other pediatric organizations on our platform. And we have a multitude of them on our platform, many, many of them. So you'd be doing a true peer-to-peer comparison. Now, you're not going to use CMS. That's not the right benchmark for you. MDaudit is the only platform in this space that allows you to choose this pediatric cohort and be compared to other organizations just like you that are only doing that very complex pediatric billing for many different specialties. So I'm going to click that. And then what you see when I click that, it is a lot more of a view that is consumable and allows you to go up here and concentrate on that habitual overcoder. But I can actually come down here where I see more of a cluster, something more concerning down here of undercoding, a lot of loss of revenue there. And with margins the way they are, you're going to want to concentrate down here. You can concentrate in both places, but let's go down here. Now, these bubbles size makes a difference, but I am seeing this is a pediatric cardiologist, and right next to it, although a smaller bubble, is pediatric surgery. I'm going to just click surgery because in my experience, surgical providers can sometimes, even though they have maybe a smaller amount of volume, do much heavier upcoding, but you can click on any of those bubbles. Now what I can do is actually go to the bell curve. And when I do that, I have a perfect vision that I can share with the provider of where they are. And what MDaudit has been able to do is say, hey, provider, 53% of every single one of those E&Ms is going out as a level 2, very, very low level. That's this line, the one MDaudit has found an outlier. Now, if I go down to this line, this is going to represent all of those providers internally at your organization. That's the internal benchmark, only doing that 10% of the time. So we're able to say, hey, doc, you're way up here, and your peers in that same specialty is way down here. And this blue in the back, you can see is what is normal. When that's the MDaudit community, that multitude of other pediatric organizations just like you, only doing that 17% of the time. Now, there's all types of skew over this side, but I just want to concentrate here. What we're able to tell you immediately, just in one click, is you definitely want to audit this physician. He or she is billing much outside of normative ranges, both compared to their peers and all of the other people in that pediatric surgical specialty that's using MDaudit as a platform. So again, going back to the bubble chart, we're able to show you exactly where your risk is. And then we can give you this visual that you can share with the physician. Now, more important than that is how do I go in? If I want to go in right now and audit this physician, how do I do that? That's the risk areas dashboard. This is incredibly important. So MDaudit, again, is the only platform that will not only show you the analytics of overcoding, undercoding, and risk, but we also take all of your pediatric providers that are suspected of overcoding and undercoding, and we place them on the risk areas dashboard. And I'll tell you why we do that. So if I read that little string there, it says, hey, this is Dr. Smith. He is a pediatric gastroenterologist. It's showing me that there's an office visit. He's struggling with the level 4s. If I move down here, here's a cardiologist. And I move down here, another cardiologist. So again, all of my providers and all the different pediatric specialties that are overcoding and undercoding. Now, this weight is also very important. You can see that ranges from, right now we've got all 3s, but that can go up actually as low as a 1. So these are providers that are at very high risk. If this was a 1 weight, still at risk, but not so egregious. So we've got a bunch here that really need to be audited. And what's nice about it is I can go over here and actually look at an information card. It tells me exactly what's going on. This is a pediatric gastroenterologist struggling with the level 4s. In this case, he looks like he's overbilling them. There'll even be a running tally of total charges that have gone out in total and per day, because that's a huge sign of risk if a lot of these are being sent out to his respective payer mix. And most importantly, that he's 5.1 standard deviations over what's considered normal. Again, considered versus that MDaudit benchmark, that pediatric benchmark very specifically. But the most important piece from here is this, is create an audit. I know I keep on saying this. Of course, I'm a little biased, but MDaudit is the only platform that allows you to do this. click create an audit. That launches me from that analytical risk ranking into what you're seeing here, a workflow, seamless integration. So I can go in and say, hey, I am with the coding team, and I'm going to assign this to Dana, and I'm going to hit continue. And the system has actually smart enough to know that you have to audit the level 4s for this rendering NPI that works at this facility. Now, you can also go in and add, I want to see when that was billed to Medicare Part B or Blue Cross or a combination of those two. You can also add in when it's billed with a modifier 25. I can even put that in there. And once I hit these arrows, the system immediately finds the 21 claims in our database, because we have the ability to ingest your claims on a daily basis, the 21 that meet that criteria that you need to audit. You can put in a sample size. I have it set at 10. You can put in 20. Very similar to how RatStats does its randomization. You can then hit continue and create audit. And at that point, you have those claims at your fingertips. So there's absolutely no reliance on IT or spreadsheets or anything manual. You have your claims right in front of you. So you can go in and actually do your review of what went out on that claim. We're going to come back to that as we let it run. But I also wanted you to know that we also have some great procedural based data. So E&Ms are one thing to glean risk from. But if you come to this procedure utilization dashboard, you can see here, I have that set for, and that may be hard for you to see, but I have pediatric oncology, pediatric infectious disease, nephrology, and so on, pulmonology. All of this data below is showing me, you know, if I want to, what are my neonatal pediatrics doing? What are my gastroenterologists doing? I'm able to come down and see what they're billing from a procedural standpoint. And this is a great point to say, well, I expected them to do this many procedures, but we're really low over here. I can then change that to allergists and see exactly what they're doing. So point being, we're not going to go through all of this today, but when you understand risk from an E&M perspective and those higher paying procedural perspective, you're in a great place to, again, minimize risk and maximize revenues. And again, this is all pediatric based. We support pediatric organizations. Now, going back into that workflow piece, I now have this claim to review. I can very easily go in and agree with what I agree with, but I can also go in and make edits. So I'm going to agree with that modifier 25, but I'm going to go in and edit this. I know that that level 4 is actually a level 2. I'm going to do 99212, and I'm going to put that there. And I'm going to say that I disagree. There's many different ways you can put in, do you agree, do you disagree? I'm just going to say I could disagree. And then I'm going to put in comments as to why I disagree. At the end of the day, all of this is captured so I can share it with the physician. Not only do we allow you to just level it yourself, but we also offer E&M worksheets that will help you with that leveling. 2021, 2023, they're all in there for you to be able to go in and have the system help you with that leveling exercise. So auditing aids like E&Ms. We also have what we call risk area worksheets. And I'm going to put one in here just to kind of show you what I'm talking about. Very specific to pediatrics. Here's where I have an auditing aid for neonatal and pediatric critical care that walks me through everything I need to ask myself to ensure that this is being billed appropriately. So what I want you to take away from this, folks, and I know I'm going through a lot really quick, though, is we have the ability, again, to show you who is overcoding and undercoding. We have the ability to risk rank them for you and then allow you to create an audit, which then allows you to have immediate access to the claim so you can do a coding quality review. This all gets captured so you can share it with your physicians for corrective action, and that will absolutely mitigate issues going forward. And very powerful auditing aids, whether you need help with E&Ms or those really risky things that are being scrutinized by the OIG and RACs and MACs at your fingertips, again, as a pediatric organization. And of course, all of that procedural stuff you need to look at as well. Now, one other thing I want to talk about, very, very important, is denials. What you just saw was everything we can do to do analytics over your charges, your claim volume. But it's also incredibly important to understand what's going on from a denial perspective. So just like your claims, we have the ability to ingest your denial activity on a daily basis. So let's take a look at that. I'm able to come in and look at coding related denials, patient access, whatever I want, but let's concentrate here. It's very easy for you to come in and see your denial trajectory, what's going up and what's going down. I can see here, there's been 11% increase in the last month. So I can very easily hit these 2 points where there's that increase and run an analysis. This is AI in action, helping you, because you're so overwhelmed with other things you need to do, go educate physicians, do some more risk-based audits, telling you this is exactly why there's been an 11% increase. Right here, diagnoses are invalid for the dates of service reported. You also know the account numbers you need to worry about, just maybe these kind of top 2. You also know the payer, really just a couple of payers. More importantly, your rendering providers. Right here, there's 3 of them you really need to concentrate on. You can even get into procedure codes. Which ones? This is a very, again, easy way to understand providers at risk from a denial perspective in your pediatric population. Again, if I want to come down and see what were the diagnoses that were invalid, I can actually drill down to that and see what were they. And I can see a lot of them were for pneumonia, unspecified, and so on. So point being, a lot of us kind of get lulled into thinking that analytics for our pediatric billing should only be looked at through the claims volume, overcoding and undercoding, but we also want the ability, you have to, in a risk-based approach, look at your denials as well. Another thing I kind of want to talk about is that was AI, but you also want to be able to have some easy navigation yourself. So I can go in and say, wow, what's the monthly denied amount among my functional areas? And I'll have a nice rolling 12 months here, updated daily. I can go in and see, what does it look like for patient access, patient financial services, credentialing, whatever it may be, you're able to see those spikes and lulls. I'm going to go into coding again. But whenever we get here, I work with a lot of pediatric organizations. Whenever we get here, we get a little deer in the headlights. God, I've got a really bad coding issue. How do I figure it out? Drill down, ask for the reason. What were the reasons? And it'll clearly, our platform can clearly show you there's a lot of reasons, but your number 1 here, medical necessity. And then I can drill down and say, well, what payer? What payer is dinging me for that medical necessity? And I'll know it's here. And then I can actually get down to the rendering provider group. That's a specialty. Is it endocrinology? Is it gastroenterology? Whatever it may be, and rendering provider name. I can get down to all of that information as I continue to drill down. Point being, we don't want you drowning in denials data manually. We want you to be able to get to root cause so you can have better adjudications, gain more money, but you have all of this at your fingertips. And again, I work with a lot of pediatric organizations. They're all starting to not only take in claims volume through analytics and find the at-risk areas, but denial volume as well. Absolutely something you want to look at together. Now, the last thing I'm going to show from here is a lot of us, like technology, but we think it's hard to use. There's a whole change management piece that we try to tackle, and it's hard. It's hard to change. But let me just show you something it's called conversational AI. And I can go in and ask any question I want in plain English. And I'm not going to type this in front of you. I'm just going to do this. I'm going to say, what rendering providers had the highest amount of denials last year? That's all you have to do is ask it in plain English. And AI can be your friend. People in AI always have to work together. People in technology always have to work together for the appropriate answers. But you'll see here, it's thinking, and it's stack ranked my providers with the highest amount of denials last year. And I could have said last Tuesday if I wanted to. So I now know it's Dr. Smith, followed by Dr. Finnegan, and so on. If I hit pin, I can create my own dashboard. It's that simple. But now from here, if I ever wanted to, I can say, okay, Dr. Smith, he's a pediatric oncologist. I need to drill down to know what payer is dinging him the most for those denials, for medical necessity and so on. And I have it right at my fingertips. So I also want to send you away with that. MDaudit not only supports pediatric billing, compliance, and revenue integrity through a lot of capabilities that you're seeing right out of the box, but if you need to do your own queries, you want to ask your own questions, you're not dependent on your IT, you're not dependent on spreadsheets, you're not dependent on us. You can ask your own questions in plain English and get the answers you need. Now, where does this all end up? Technology is great, but what's the end game of this? So if I can tell you that we have a multitude of pediatric organizations using our platform to do risk-based audits for billing compliance and revenue integrity. But I want to show you something here. We have, as you're doing those audits and unearthing things, whether it's pro-fee, inpatient and outpatient, you're able to go in, and we're going to concentrate pro-fee today, but please know that if you're a pediatric organization, we help you with this on all chart types, pro-fee, inpatient, outpatient, you name it. Everything you do, all of the audits you do provides these powerful dashboards, again, out of the box, and you can create your own as well, that shows you what you're unearthing. And I'm going to give you an example of that. Not only does it show you what you're unearthing, but how to move forward. So for example, here's the top 10 E&M codes you've been disagreeing with. And you can see over here all of the different reasons why you were disagreeing. Overcoded one level, incorrect E&M category, and so on. But it's very easy for me to see as an auditor or an analyst, disagreed 257 times with the level 3, but 157 of them were undercoded. I can very easily drill down and say, what's the rendering provider group? What specialty? That can bring me to, let's say it's pediatric oncology or pediatric medicine, whatever it may be. And then I can drill down and say, well, that's great, but who are the names? Is it one physician? Is it 2? Is it 10? Where do I need to concentrate my efforts? And you can see here, one physician, go and have a corrective action plan with he or she. I can see that for missed procedures. I can see it with CPTs for the largest underpayments and overpayments. You name it, whether it's a modifier issue, a procedure code issue, diagnoses. We are capturing everything you're doing so you can very easily go in and drill down and understand where to go next, who to educate, and that organically will lead to less issues, better first pass pay rates, and at the end of the day, billing more compliantly if you understand that root cause. So we're running out of time, but hopefully what I want to get across to you is whether it's your claims data, your remittance data, we can help you optimize billing, coding, and revenue outcomes in a very intuitive, streamlined platform. And if you take anything away from this, again, we're the only vendor that can provide analytics that also seamlessly back into this workflow where you can grab the claims and do your job without any reliance on IT, your EMR vendor. It's all here at your fingertips. Now, what I want to do is very quickly share a case study, and then we're going to also have time for questions. Case studies. So proof is really in the pudding. So let me put that up. This is just one case study. Again, we have a multitude of pediatric organizations using our platform. This is a customer success story for one of them. You can see on the left, the customer profile. They're a very, very large pediatric multi-specialty organization providing very, very complex services. The challenge was a lack of automation. They were trying to do one provider a year, weren't even making it to all of their providers. The solution is they went live with MDaudit a few years ago and shifted to a risk-based approach. Again, only deploying resources to those highest risk areas. You can see there by using the platform's advanced analytics, they were able to proactively reduce denials and improve speed to reimbursement. Hugely important now that commercial payers are taking so long to actually pay. Better first pass pay rates, better billing compliance. So really the results, you'll be getting this deck, but they really basically quadrupled the amount of audits they were doing, reduced denials. And at the end of the day, you'll also take a look at that quote. It's telling you what I just tried to show visually, is it's making your process more efficient. You have everything in one place, audits, reports, documentation, and more. So everything you unearth through the analytics can be shared with your providers and others in the organization, breaking down some of those silos so you can create a united front and make things just better and support better margins. Again, you'll be getting this deck. You'll be able to see the full case study as well as this recording. But what I want to do right now, with just a couple of minutes we have left, is go to Q&A. So Joy, I know you've got some questions out there. I've seen a bunch come through. So can you throw a few of those at me before we end at 12:30?
Sure, Dana, thank you. The first question is, does MDaudit work with any EHR and billing system?
Yeah, that's a great question. So one of the things I didn't describe is MDaudit works, the magic and the analytics work on our ability to daily ingest your claims and remittance data. So whether you're Allscripts, Epic, Cerner, IDX, as long as your billing system produces the ANSI standard claims, meaning the 837Is, the 837Ps, what we think of as the 1500s or UB04s, this will work. Doesn't matter what billing system, as long as it produces those ANSI standard claims and remits, this will work perfectly for you.
Great, thank you. The next question is, how long does it take to implement a solution like this, MDaudit?
Yeah, so obviously there's always, that change management involved. People have to be ready for change. We help you get to that place that will show the return on investment. But once we have going through getting the claims data and setting things up and all of that, you can be, I'll call it audit ready within 4 to 6 weeks. So this is a very quick ramp up period. And that happens because, claims data, as long as we can get it, where your claims and remit data is going, we can ingest that. Really great training. We get people ready, but no more than 4 to 6 weeks to be audit ready.
Great, thank you. And just one last question. If we didn't respond to your question, we will follow up post-webinar. The final question, do the analytics take into account all payers?
Yeah. So that's a great question. And I suspect it's because we're coming from a pediatric organization. We know Medicare and Medicaid is not your purview. So this works for all of your payer mix, your commercial payers as well, that non-Medicare, Medicaid stuff. So it works for your entire payer mix. So doesn't matter whether it's Blue Cross, Cigna, Aetna, whatever that insurance is, this is going to work exactly the same way. So it looks like we're getting close to 12:30. So folks, we had a lot more questions. We'll make sure to get back to you. But if there's anything else you want to hear from MDaudit, please reach out to us. But I appreciate your time today. And again, we will be sending you this deck and the recording, and hopefully we will hear from you as well. Looking forward to it. Thank you very much for your time, and we'll talk soon.